In the context of communicating, credibility is very important. Now that's credibility of the facts. The facts have to be understood by the audience as being credible and relevant. So some facts people may look askance at if they feel that the person conveying the fact has a conflict of interest, for example. If you're known to be receiving money from the person who has commissioned the work, then your credibility is much less because of that. In government, people feel that the change being advised, for example, by an organisation like NICE, is in fact a device for enabling the Treasury to secure a lower level of public funding. Well, the credibility of that audience, the credibility of that source might be queried. So the credibility depends very much on the view the audience has of how free from bias you are in giving that advice. The credibility of clinical trials is at the moment a subject of considerable debate, because although the facts are often well established and can be verified, there is a fear that many of the clinical trials are funded by the pharmaceutical companies who have an obvious interest in the outcome of the trial. But once again, in the academic world, understanding the audience and their needs is as important as you projecting your conclusions. So you have to understand why they might be hostile or receptive to your needs. You have to really understand your audience. A further need for communication is almost always to change behaviour. To change behaviour, you have to make sure that the audience, be it a single person like a patient or a broader audience like your scientific colleagues, both understand the facts and understand the need to change their behaviour. Behavioural change is probably the most difficult part. For example, if you have high blood pressure, the benefits of keeping the blood pressure down are well established, very well established, and yet almost every study that's looked into this matter, the proportion of patients who are not taking the medication is alarmingly high, and somehow we fail to persuade the patient that it is in their long-term interest to take the medication. So conveying convincing evidence is very, very important in that context. The difference between communication in general and intelligent communication is that in intelligent communication you listen as well as talk.